Have you ever glanced at your blood pressure reading and wondered, which number should I really be paying attention to, the top or the bottom? It's a question that could mean the difference between managing your heart health effectively or unknowingly ignoring a silent killer. In this video, we'll unravel the mystery behind systolic and diastolic blood pressure, explore groundbreaking research, and reveal which number is more critical for your health. Stick around to learn life-saving tips that could redefine how you think about blood pressure. The numbers that matter. Blood pressure is often referred to as the silent killer because it can lead to life-threatening conditions without noticeable symptoms. It's represented by two numbers: systolic, the top number, and diastolic, the bottom number. Systolic measures the pressure in your arteries when your heart beats, while diastolic measures it when your heart rests between beats. According to the American Heart Association, 2023, a normal blood pressure reading is around 120/80 mmHg. But which of these numbers holds the key to your heart health? Let's dive into the science. Systolic blood pressure, the heavyweight contender. Systolic blood pressure, the top number, reflects the force your blood exerts against artery walls during heart contractions. It's often given more attention because it's a predictor of cardiovascular events like heart attacks and strokes. A landmark study published in The Lancet, 2018, involving over 1.5 million participants, found that elevated systolic blood pressure is strongly correlated with increased risk of heart disease, stroke, and kidney failure. As you age, your systolic blood pressure naturally rises due to stiffening arteries. This is why it's particularly crucial for older adults to monitor their systolic readings. According to the SPRINT trial, 2015, maintaining a systolic blood pressure below 100 mmHg can reduce the risk of cardiovascular events by 25%. Diastolic blood pressure, the underestimated player. Diastolic blood pressure, the bottom number, measures the force your blood exerts when your heart rests between beats. While it's often overshadowed by systolic readings, diastolic blood pressure isn't any less important. A study in the Journal of the American College of Cardiology, 2019, revealed that diastolic pressure below 60 mmHg, a condition known as diastolic hypotension, could increase the risk of heart failure and coronary artery disease. Younger individuals are more likely to experience elevated diastolic pressure due to stress, obesity, or lifestyle factors. Experts emphasize that while diastolic pressure may not be the sole focus in hypertension guidelines, ignoring it could be a grave mistake. Why both numbers matter: the bigger picture. Focusing solely on one number may lead to an incomplete understanding of your cardiovascular health. A 2022 study in hypertension highlighted that individuals with isolated systolic hypertension, high systolic but normal diastolic, or isolated diastolic hypertension, high diastolic but normal systolic, are both at elevated risk for heart disease. These findings underscore the importance of considering the broader context of your blood pressure readings. Understanding the pulse pressure connection. The difference between your systolic and diastolic pressure is called pulse pressure. A pulse pressure greater than 60 mmHg is often a marker of stiff arteries and cardiovascular risk. Research from the European Heart Journal, 2020, emphasizes that monitoring pulse pressure provides an additional layer of insight into your overall heart health. Key factors influencing blood pressure. Several factors affect both systolic and diastolic readings. Age: older adults are more likely to experience elevated systolic pressure, while younger individuals may face elevated diastolic readings. Gender: before menopause, women typically have lower blood pressure than men. After menopause, this trend reverses. Lifestyle: diet, exercise, smoking, and alcohol consumption play significant roles in determining your blood pressure levels. Underlying conditions, diabetes, kidney disease, and thyroid disorders can skew both systolic and diastolic readings. What experts say: systolic versus diastolic. According to Dr. Paul Welton, lead author of the 2017 ACC/AHA Hypertension Guidelines, systolic pressure is often the primary focus because it tends to rise more dramatically with age and carries a higher risk of complications. However, Dr. Welton also emphasizes that overlooking diastolic pressure, particularly in younger patients, could lead to underdiagnosing hypertension. How to measure and interpret blood pressure. Accurate measurement is key to understanding your blood pressure. Follow these tips. Rest. Sit quietly for 5 minutes before measuring. Position. Keep your arm at heart level and avoid crossing your legs. Repeat. Take multiple readings at different times of the day and average them. Use tools like at-home monitors approved by the American Medical Association 2022 to keep track of your numbers. Lifestyle changes to manage both numbers. Managing blood pressure requires a holistic approach. Diet. The DASH diet, Dietary Approaches to Stop Hypertension, emphasizes potassium-rich foods like bananas, spinach, and sweet potatoes. Exercise. Aerobic activities like walking or cycling can lower systolic and diastolic pressure. Stress management. Practices like meditation and deep breathing help reduce blood pressure. Limit salt. Aim for less than 2,300 milligallons of sodium daily, or 1,500 milligallons for optimal heart health. Medications and treatment options. For those unable to control blood pressure through lifestyle changes alone, medications like ACE inhibitors, beta blockers, and calcium channel blockers may be prescribed. A 2021 review in the New England Journal of Medicine stresses the importance of individualized treatment plans based on whether systolic, diastolic, or both pressures are elevated. Emerging research and technologies. Exciting advancements are on the horizon for blood pressure management. Wearable monitors, devices like smartwatches now offer continuous blood pressure tracking. AI algorithms. Predictive tools are being developed to assess cardiovascular risk based on blood pressure trends. Precision medicine. Tailored treatments targeting specific blood pressure patterns are becoming more common. So, which blood pressure reading is more important, systolic or diastolic? The answer is both. While systolic pressure often takes the spotlight due to its stronger association with cardiovascular events, diastolic pressure provides critical insights, especially in younger individuals. Monitoring both numbers, along with pulse pressure, offers the most comprehensive picture of your heart health. Take charge of your health today by regularly checking your blood pressure, adopting heart-friendly habits, and consulting with your healthcare provider. Your heart will thank you for it. If you found this information helpful, don't forget to like, comment, and subscribe for more health tips that can transform your life. Share this video with someone who might benefit from learning the truth about blood pressure.